Good day, ma'am. My name is Brigido Amanya, and this is my synthesis about child abuse. Child abuse is important since there are very high risk of father-ish assault on or death or the children of siblings. The children who has been subjected to abuse is often called and may also be malnourished and generally neglected. There may be also evidence of previous trauma. Psychological trauma from abuse can result in sleep disturbance, balance, eating disorder, development growth failure in our children, and nervous habits such as flip and fingernail beating and thumb shaking. Effect might also include chronic underachievement at school and poor peer relationship. In abuse family, physical neglect is commonplace with indicate provision of basic needs including medical and oral health care. There will be delay in seeking care. Some suffer significant neurological, intellectual, emotional damage. Injuries in child abuse can be varied and are often multiple, including bite marks, bruises, black eyes, torn perineum, hair loss, laceration, ligature marks from the gag, burns on skull, often from cigarettes and demonstrate from another object. Teeth revitalized, broken, or lost. Bone fracture are common, mainly affecting ribs or long bones, but the skull and joints can also be fractured. Head injuries are commonest causes of death in abused children. There are three categories of child abuse: physical abuse, neglect, sexual abuse, but I also apply the emotional abuse in my report. Physical abuse risk factor for physical abuse includes parental ignorance in relationship to the child development abilities combined with parental immaturity, violence in the home, and high level of family psychosocial stressor, premature birth, or the presence of disabilities has been thought to lead to increased risk for physical trauma. Children of teenager mother have a relatively high risk for all forms of physical abuse. Sexual abuse. Molestation may include contact with a genitalia, anus, or mouth, or may be in the form of exhibitionism or pornography, and perpetrator usually is known to be child. Although incest is a most commonly form of child sexual abuse, it usually missed of and recognized by clinician. Incest usually occurred between the biological father or stepfather and a daughter and stepdaughter, but it can occur between father and son as well as mother and son. Consideration and betrayal of trust and the power imbalance in this one side relationship. One such definition is the position of sexual inappropriate act or act with a sexual overtone by one or more person we devise authority through ongoing emotional bonding with that child. This definition expands the tradition definition of incest of including sexual abuse by any who has authority or power or the child. This determination of incest includes a preparator, immediate or extended family members, babysitters, teachers, scoutmaster, and so forth. Often more than our type of abuse occur at the same time. Neglect is most commonly reported, followed by physical abuse and by the sexual abuse. Emotional abuse is a common form of abuse that occurs in close relationship. It also known as a physiological abuse and includes verbal abuse. Emotional abuse is about one person maintaining power or control over another person. It usually takes place between immediate partners or comes from a parent to a children. It also happens at situations such as schools, workplace. Emotional abuse can have serious negative effect on the physical and mental health of adults and children. Emotional abuse can have serious negative effects on the physical and mental health on adults or children. Emotional abuse is an experience both of men and women, but are more likely to be experienced by women. Emotional abuse and neglect of children also occurs but can be hard or utilized to delete admire. Child maltreatment is a major public health problem affecting at least one or three children before the age of 16. Recent increase in the rates of neglect and intimate partner violence explore have been inhabited to widening definition of children maltreatment as well as professional improbability to neglect maltreatment. Child maltreatment in any form cause long-lasting harm to child health and development. The lifetime economic cost of CSA child sexual abuse alone have been estimated to be 9.3 billion, recognizing the abuse interview and address its detrimental effect. Maltreated children are the rest of a multitude of health problems such as growth, development, and chronic physical and mental health conditional and extend into adulthood. Substance abuse, the criminality on adolescence and adulthood are also frequency abuse and this individual there is a long growing evidence of the neurobiological effect of all types of mental treatment. Physical abuse are much higher in infancy and toddlerhood. The rate of death increase when the child have with an unrelated adult but overall has been constantly dropping over the past 3 decades. Sexual child abuse. All the clinical symptoms of CSA are not apparent. 1/3 of victims at the time the abuse are reported. CSA child sexual abuse victims are the rest of experiencing mental health problem including traumatic stress disorder, depression, substance abuse of dissociative symptoms, feeling that one's conscious experience is disconnected from one's environment, body, or emotion. Risk if unprotected sexual is also common among victims. In adulthood, CSA victims often continue that deal with mental health problems are phone environment and violent relationship and women are two to three times more likely to be sexual assaulted. Girl experience a two-fold risk of CSA compared with boys. Support from the parent who is not the perpetrator and the prior history of abuse has been indicated of protective factors that can help children cope with the abuse. Neglect. Unlike abuse, neglect is typical not committed intentionally and often result from problems that impair to parents' ability and meet a child needs. However, the neglect consequence of neglect can be as damaging as this of abuse, especially when it can several traumatic and when it occurs early in life. Neglect child are the risk for experiencing physical or mental health problems. In preschool and school age child, social withdrawal, neglect, peer relation, academics difficulties, and depression are more common among neglect children neglect with abuse victims. As adults, they show similar risk of environment and violence relationship compared with those who are physical abuse. Emotional maltreatment. This form of maltreatment is life faculty of determine and document as it is less visible in its impact. Children exposed to emotional maltreatment and experience trauma, stress, and leads to physical and or emotional impairment such as behavior, e.g., alcohol abuse, and early and persistent psychotic disorder. Prevention and intervention. The key of reduce child maltreatment is a strong focus on prevention strategy used to prevent the occurrence of maltreatment have been grouped into three major categories. Prevention before occurring these include universal and targeted programs. The best evidence is for the nurse family partnership and intensive program of nurse home visitation, provided to first-time social disadvantaged mother home visit program, earlier star and parenting program. Triple P are promoting but needs further evaluation to determine their effectiveness. Hospital-based educational program to prevent abuse, head trauma are also promising but needs mother study. Enhanced pediatric care for families of children at risk of physical abuse and neglect as also promising but neglect further assessment. School-based educational program appear to improve children knowledge and protective behavior and may increase the likelihood and disclosure. Prevention of recurrences is much more challenging. One program, parent-child interaction therapy, has shown benefits of reduction to frequencies of physical abuse. Home-based training such as safe can also slightly reduce the recurrences of child maltreatment of preschool children. Provision of impairment programs, especially cognitive behavioral therapy (CBT) and interpersonal psychotherapy that flows on reducing mental health problem for mentored children have been shown uh, improve their well-being. Trauma focus CBT for sexual abuse children and effective in reducing post-traumatic stress disorder, symptomatic as well as externalizing and internalizing problem. Resilience oriented programs may be involved approach to tempering the impact of emotional maltreatment. Group based interventional of mothers and children of preventing skill training along with practical support for parents of upper parent promise of children expense of IBP. Children at risk of maltreatment can benefit from structured enrichment activities until caring consents adult outside of the home, e.g. school, quality preschool. In a small majority of areas investigated by Child Protective Service, children needs to be removed from the home for mental treatment and ongoing safety concerns. In this case, post on can enhance children mental and physical health and provide better outcomes in behavioral, social, and academics realms. Given that financial difficulties put children at risk of maltreatment, fighting priority can go a long way, and promoting children's safety in additional policing on employment flexible can help parents establish a health balance between their home and job responsibilities, promoting compared resilience in context of adversity is important. Professional working with children can contribute to making reduction of child maltreatment a priority. Abuse and neglect should always be considered in the assessment of children operating with injuries mental health problem. Training worker should also comes familiar with the culture context of which children grow up and ensure that children needs for safety, natural and protection are met on matter with the culture practice.